Halloween, everyone's favorite holiday. I can see it now. That candy corn that compels even the most hardcore trick or treaters to say, how is this still a thing? The smell of rotten eggs outside your front door because you're that lame neighbor you never wanted to be. The one that doesn't open their door and leaves a bowl of candy outside instead. I mean, you're just asking to get your house egged. Rotten sulfa smelling eggs are our recurring sketchy symbol for sulfa drugs. And while we're going to emphasize trimethoprim sulfamethoxazole in this sketch, we're going to cover a lot of side effects of antifolate and sulfa drugs in general. So let's get started. Sulfonamides are antifolate drugs. Mammals, like you and me, obtain folate exogenously through our diet. Sulfa-susceptible organisms, however, must synthesize it themselves from an intermediate called p-amino benzoic acid, or PABA. In this sketch, PABA is going to be represented by a PABA Papa Panda, this father figure who's dressed up and handing out cookies at the front door. Notice the cookies he's handing out resemble purines. This is because PABA is going to be the beginning of the folate pathway that leads to synthesis of purines and eventually DNA. Two steps are required to turn PABA into dihydro and then tetrahydrofolic acid. These two intermediates will be represented by the two-leaved and four-leaved bamboo costumes worn by the two children at his sequential front steps. They're dressed as bamboo because it's kind of like foliage, and foliage is our symbol for folate, found in leafy greens. Uh-oh, one of those family-themed costumes. Ugh. Well, some of the neighborhood kids aren't too happy about this desecration of a revered national holiday, and their response will illustrate how the drug Bactrim, or trimethoprim sulfamethoxazole, works on two sequential steps in the folic acid synthesis pathway. See these two creepy twins? Holy crap, they look straight out of The Shining or something.
Come play with us, Danny, forever.
These twins represent that combo drug trimethoprim sulfamethoxazole. The one labeled SMX represents sulfamethoxazole, a sulfonamide, and that's why she's holding the sulfa eggs. She aims for PABA Papa Panda because this sulfa drug is a PABA analog that blocks the first enzymatic step, dihydropterate synthase. Notice Papa drops the cookies as the sulfa eggs hit him. Dihydropterate affected by sulfamethoxazole. The other twin labeled TMP represents trimethoprim, which sounds kind of like TP, and that's why her projectile of choice is toilet paper. She's letting it fly at the cookie being passed between dihydro and tetrahydrofolate, representing the second enzymatic step being blocked, dihydrofolate reductase. And notice that the dihydro bamboo ducks as she's bombarded with the trimethoprim TP. Dihydrofolate reductase is blocked by trimethoprim. So, as you can see, an inhibitor of dihydrofolate reductase like trimethoprim combined with a sulfonamide leads to a synergistic enhancement of the activity of both drugs. They're bacteriostatic when separate, bactericidal when together. Let's sketch in some clinical scenarios when this combination is used. And remember, when you see trimethoprim toilet paper and sulfa eggs together, think of that synergistic combination. Trimethoprim sulfamethoxazole is often the first-line treatment for UTI in men and women. This will be represented by this porta potty, vandalized by TP and sulfa eggs. These festivities have definitely gotten a little out of control, and the vandals aren't done yet. See the guy waiting in line? He's holding our recurring sketchy symbol for UTI, that bladder-looking beverage. But notice that he's fallen for the oldest trick in the book, the old egg down the pants while waiting in line for the porta potty gag. Okay, that sounded way too specific. Almost like I'm revealing some kind of repressed Halloween memories. Anyways, this is to highlight Bactrim's effectiveness in treating acute prostatitis in men. I really want to convey that these GI and urinary tract bugs represent Bactrim's important gram-negative coverage, and that's why the porta potty and costumes are red-themed, our recurring gram-negative color. Trimethoprim sulfamethoxazole also has activity against gram-positives, including Staph aureus strains, even MRSA. Look at this trick-or-treater here. He's holding a golden staff, a recurring Staph aureus symbol. Okay, that's fun. And it looks like he's dressed as a cute little pharaoh. Oh, wait. Oh, he's joined in the vandalism, spraying no mercy on the garage door. The words no mercy next to our recurring merciless pharaoh are to remind you of MRSA coverage. But remember on an exam to think of the big guns against MRSA first, which include vancomycin, daptomycin, and linezolid. Trimethoprim sulfamethoxazole is also the drug of choice for treating another gram-positive bacterium, nocardia, symbolized here as our nocardia, partially acid-fast, card-dealing cowboy. He's helping out our MRSA pharaoh with some innocent vandalism of private property. Notice he's spray painting these long chains, and that kind of represents nocardia branching colonies. The fence they're vandalizing is purple because nocardia and MRSA represent the gram-positive coverage of trimethoprim sulfamethoxazole. Now take a look behind the fence. We're going to sketch in a representation of Pneumocystis jirovecii pneumonia, or PJP. It's an indolent pneumonia that usually affects HIV-infected individuals. And here we have that old neighbor. You know, the one who turns his lights off to pretend no one's home. Well, his house was vandalized by those young sulfa punks, and he appears at his door, still in PJs, representing PJP. His cane is our sketchy symbol for immunocompromised, and he's holding his ping pong paddle to remind you of our Sketchy Micro PJP sketch, in which we emphasized the crushed ping pong ball shape of this yeast-like fungus.
What's going on?
Go back to your ping pong game, Leonard. Every year. Trimethoprim sulfamethoxazole not only treats PJP, it's used as prophylaxis for HIV-infected patients with CD4 counts less than 200, which will be represented by the address on his sulfa egg-filled mailbox. The house behind his also has a sulfa-filled mailbox, House 100. This is because with CD4 counts less than 100, trimethoprim sulfamethoxazole is used for prophylaxis against toxoplasmosis. Toxo is that parasitic infection spread by cat litter, eventually affecting your central nervous system if you're immunocompromised. It's caused by Toxoplasma gondii, and if it isn't that crazy toxo cat lady from our Sketchy Micro sketch, preparing for what has to be her favorite holiday by dressing up her cat as Gandhi. Oh, animal cruelty is so endearing. So, trimethoprim sulfamethoxazole is used for prophylaxis, but toxo is also treated by a similar sulfonamide and folate inhibitor combo called pyrimethamine and sulfadiazine. Don't let that confuse you, though. They have a similar mechanism of action as that trimethoprim sulfamethoxazole combo, and it still has that sulfa-sounding name. So we'll include some stinky dyed eggs on her doorstep left over from Easter, sulfadiazine. To remind you of pyrimethamine, we have incorporated a pyramid shape into the Toxo Lady's witch hat. Let's briefly revisit that folate inhibition scene taking place on Panda Dad's doorstep. This mechanism of action is important to remember because this inhibition of folate leading to inhibition of DNA synthesis causes all kinds of cytopenias. So we'll sketch in an empty pan for pancytopenia. Only a few Halloween cookie crumbs left. This cytopenia can also manifest as a megaloblastic anemia. So we'll sketch in our recurring megaloblastic fireworks, resembling the characteristic pale and enlarged red blood cells. If used in the first trimester, trimethoprim sulfamethoxazole is teratogenic because of its antifolate effects that lead to neural tube defects. So we'll sketch in our teratogen tarantulas dangling from the panda dad's rooftop. The rest of the sketch will be dedicated to the sulfa component of trimethoprim sulfamethoxazole. These are pretty classic reactions that you need to remember, and you should keep them in mind for all sulfa drugs. In later sketches, we'll use our recurring stinky sulfa eggs to emphasize that a drug is a sulfa drug. And notice that we've included these side effects on the sidewalk. Sulfonamide-containing antibiotics are the second most frequent cause of allergic drug reactions, after the beta-lactams. And speak of the devil, this allergic reaction will be embodied in our little devil trick-or-treater. A little itchy, definitely feverish, because the most common sulfa allergy reactions include rash, fever, and urticaria. Anemias can also develop in allergic patients, and if you're G6PD deficient, sulfa drugs can trigger hemolytic anemia. This is represented here as this watermelon slice getting poked by his little pitchfork. Notice that it has a bite out of it, just like a bite cell. Think of those pesky watermelon seeds as those Heinz bodies that the spleen removes in G6PD deficiency. Stevens-Johnson syndrome is a relatively uncommon but serious type of skin and mucous membrane eruption associated with sulfa drugs. It's represented by the red mask that's falling off his face, highlighting the sloughing of mucous membranes that characterizes this potentially fatal side effect. Technically, it's a Tengu mask and should remind you of toxic epidermal necrolysis, or TEN, and Stevens-Johnson syndrome. Take a look at his friend who just has to outdo him every year and is dressed up as a mad scientist. He embodies all the renal side effects caused by trimethoprim sulfamethoxazole. Dr. Jekyll over here has 4 test tubes. This is because this drug can cause renal tubular acidosis, specifically type 4. So imagine the test tubes containing acid, and the 4 tubes are making a K shape, because type 4 renal tubular acidosis leads to hyperkalemia. On the sidewalk next to them is an enormous bag of little round blue candies. Kidney-shaped, it represents the interstitial nephritis caused by sulfamethoxazole. The little round blue candies similar to the monocytic infiltrate in the interstitium seen on histology. One of the parents has to embarrass them before they go out trick-or-treating, so she wants a picture. The little devil hides his face from the flash of the camera to highlight photosensitivity caused by trimethoprim sulfamethoxazole. Up next for a picture is the baby brother with the cutest Halloween costume ever, a candy corn. See how the baby's face is yellow? This is to represent Kernicterus of the neonate, a kernicteric candy corn baby. Sulfonamides, when used during the last month of pregnancy, displace bilirubin bound to serum albumin, thereby increasing free unconjugated bilirubin levels in the neonate. Sulfonamides are also known to displace other drugs from albumin, such as warfarin. Let's give our photo-happy mom the family photo album, that's album for albumin, and distracted as always, all the photos are falling out of it, getting displaced, if you will. The mom, way too into this whole Halloween thing, is covered in fake blood. Remember, drugs like warfarin getting displaced from albumin, leading to increased risk of bleeding because of over-anticoagulation. In fact, sulfonamides can increase concentrations of numerous drugs because they inhibit metabolism by the cytochrome P450 system. And, as always, we have the cytochrome represented by the chrome bumper of this car, with a CYP 450 license plate. Inactivated, of course, as you can see by the extensive sulfa egg vandalism. Well, let's sum up this sketch. Trimethoprim sulfamethoxazole is a drug combo that blocks folate synthesis at 2 sequential steps. Sulfamethoxazole is a PABA analog, and it blocks that first step we talked about, dihydropterate synthase. Trimethoprim, represented by that girl throwing teepee, blocks the second enzymatic step, dihydrofolate reductase. This drug combo is first line for UTI and also has extensive gram-negative GI bug coverage. Over at The Fence, we show coverage for MRSA and also that partially acid-fast cowboy Nocardia. Trimethoprim sulfamethoxazole is used for prophylaxis for PJP if the CD4 count is less than 200. And you're also prophylaxing for toxo if the CD4 count is less than 100. Remember, any drug that blocks folate production can cause numerous cytopenias, including megaloblastic anemia, highlighted by the fireworks in the back. Antifolate drugs are also teratogenic, causing neural tube defects. So remember those teratogen tarantulas. Other sulfonamide side effects are on the sidewalk. This includes allergic symptoms and hemolytic anemia if G6PD deficient. Sulfonamides can increase the concentrations of numerous drugs, both from displacing them from albumin and from inhibition of the cytochrome P450 system. So watch out when you give it with warfarin. You know what? There's one other side effect I forgot to mention. Darkness falls across the land. The midnight hour is close at hand. A lupus werewolf crawls in search of blood to terrorize y'all's neighborhood.